Let's see, let us slide by 10:45, and it's now 10:46. Let me just check and see if our committee members are still with us. Dr. Sung Oh, are you
I'm back.
on? Okay. Jig Patel, are you back?
I'm back.
Jason Weiss?
I'm here.
Carol Butler?
I'm here.
Albert Wong?
I'm here.
Okay, perfect. Okay, we're on to agenda item 5, which is discussion and consideration of the proposal to expand the authority for pharmacists to order and administer CLIA waive tests for influenza and COVID. In the materials were relevant, all the relevant laws, which currently only establish the authority for pharmacists around these items. We don't have currently any authority for pharmacy technicians. So I'll assume that everyone has read those various law references. August 2020, the DCA director issued an order which waives specified professional licensing requirements and amends the scope of practice for pharmacists and pharmacy technicians to allow them to perform the waived point-of-care tests used to detect the SARS-CoV-2. Along with the waiver, guidance was issued to inform and educate pharmacies, pharmacists, and pharmacy technicians of the clinical lab requirements that apply under the DCA order. And then at the October licensing committee, the board approved, and I'm going to go ahead and read the following policy statement. The CDC has acknowledged that the flu and COVID-19 are both respiratory illnesses that are caused by different viruses that may be difficult to differentiate based on symptoms alone without testing to confirm a diagnosis. The board also recognizes that community pharmacies provide unique access for patients to obtain tests in a safe and convenient location. In recognition of these facts and existing authority, pharmacists already may provide certain CLIA waive tests. The board hereby declares its support for all efforts to secure temporary authority for pharmacists to perform CLIA waive tests for influenza and COVID during the declared disaster, as well as a more permanent solution through statutory changes that facilitate authority for pharmacists to perform CLIA waive COVID influenza testing in a safe manner. So once again, that is the policy statement that was reviewed and approved by the board at our October meeting. So today, what our task is to do is to review the draft statutory proposal to ensure that it's consistent with discussions that we've had and includes the appropriate provisions to pursue a permanent authority consistent with that policy statement. So if you go into the committee documents and you look at attachment 2, that's where you will see the draft statutory proposal related to pharmacists providing COVID-19 and influenza testing. And so specifically in BMP section code 4052.4, we would be adding section B, or this is what we're proposing, that B, a pharmacist may perform any aspect of any FDA approved or authorized point of care test for the presence of the SARS COVID-2 or influenza that are classified as waived pursuant to the federal CLIA laboratory improvement amendments as described in A under the following conditions. Condition 1, the pharmacist completes the testing in a pharmacy licensed by the board and that is appropriately licensed in California as a laboratory pursuant to BPC 1265. And number 2, the pharmacist has completed necessary training as specified in the pharmacy's policies and procedures. And in BPC section 4119.10, we would add a pharmacy located in the state may employ pharmacists to perform FDA-approved or authorized point-of-care tests for the presence of the SARS-CoV-2 or influenza that are classified as waived pursuant to the Federal Clinical Laboratory Improvement Amendments of 1988 under the following conditions. The pharmacy is appropriate licensed as a lab under BPC 1265. The pharmacy maintains policies and procedures that at a minimum describe the following. Establishes initial training requirements, including specimen collection techniques relevant to tests being performed at the pharmacy and ongoing training. Establish the necessary safety precautions to protect pharmacy staff and consumers to reduce the risk of transmission consistent with the Cal OSHA and CDC requirements. Such policy should, at a minimum, include provisions for use of personal protective equipment, cleaning and sanitizing procedures, appropriate biohazard waste requirements, and space requirements to protect the safety of staff and consumers. Ensure dedicated physical or other segregated space that allows for privacy during the testing process, provides for private consultation with the pharmacist, and to limit the potential contamination of other consumers in the pharmacy. Detail requirements for providing test results to the patient in a nonverbal manner, complying with mandatory reporting requirements to local and state reporting systems, and notification to primary care providers if consent is provided. E, ensure documentation of testing equipment, maintenance and calibration. F, ensure appropriate storage and handling of specimens, testing reagents, etc. 3, the pharmacist in charge must review the policies and procedures on an annual basis. As part of this annual review, the pharmacist in charge must also assess the pharmacy's compliance with its policies, and where noncompliance is noted, document corrective action to be taken. Documentation of the review must be maintained in a readily retrievable format for a period of 3 years from the date of completion. And 4, the pharmacy must maintain documentation related to performing these tests that demonstrate compliance with all conditions in this subsection, including the name of the pharmacist performing the test, the results and communication of results to patient's primary medical provider. These documents must be maintained for a period of 3 years from the date of making and must be maintained in a readily retrievable format. Let's see. So I wanted to read through those primary overview because I believe we spent a lot of time last time going through all of the items, and it was actually in the minutes we just approved, all of the pieces of what needs to be considered in COVID-19 and influenza testing related to pharmacists. And I believe that we have addressed all of the items that were voiced during that meeting, and so I think that our discussion now needs to be, looking at these things and, specifically and making sure that we're comfortable. So what I'd like to do is do this in kind of an orderly manner. So the first thing is, let's look at 4052.4. What would be added to that? So this would be the section B, and see if everyone is okay with what we have put in here. I know we did receive some comments back in regards to the testing in a pharmacy, that is restrictive, and I know that when we had comments during our last committee meeting that it was stated that, not always is the pharmacist performing these tests specifically in a pharmacy, that sometimes they, it might be in the same pharmacy, it might be in the same building, or it might be outside, or it might be as a drive-through. So I think that B1 we need to just look at and make sure that we're comfortable, or if we need to change that. Just from my point of view, that's something I'd like for us to discuss. So right now, focusing only on 4052.4 and the addition, and I would like to have comments from the board members first, and so to make it orderly, I'll just go through the list. I'm going to go backwards from what I've been doing. So that means, Albert Wong, I'm going to be starting with you first to see if you have any comments specifically around 4052.4.
I have no comment.
Okay. Cheryl Butler, do you have any comments? Cheryl, I'm not hearing you, and I'm looking at the handout. So are you on mute by chance?
Okay. Again, was this 4052.4?
Yeah, so 4052.4, that's section B that we would be adding, to make, as it approaches to make this statutory or actually make a regulatory change. So I'm focusing just on that section right now.
Is that the one that you just read? I'm looking, this is to order the test, right?
So this is about ordering the text, and I actually just read the whole thing. So I read 4052.4, and then I also read 4119.10. So to start, we're only looking at 4052.4, which is just that added. And so my only concern is that we might want to discuss this item number 1, that the pharmacist completes the test in a pharmacy. That perhaps it might be not necessarily specifically in the pharmacy.
Well, yeah, I understand. I agree with that because we do have drive-through, so it may not be just in the pharmacy.
And other than that, there's really not a lot controversial about this, but other than that, you're okay with what's being proposed here?
Yes.
Okay. Jason Weiss, do you have any comments you'd like to add?
No, not at this time. Thank you.
Thank you, Jason. Jake Patel, do you have any comments you'd like to add?
Oh, I think it's a great suggestion here on 4052.4, and I agree with it. Thank you.
Sung Oh, do you have any comments you'd like to add?
Hi, Debbie. I agree with you on the in a pharmacy license by the board part. I mean, if we can get some clarification from Eileen, if this were to go into the language as it is, does that mean that what is in a licensed pharmacy, does that include parking lot of the pharmacy? I think we need clarification on that. Also, I know I'm being ambitious, and our agenda item specifically says, influenza and COVID. But I really think we need to also look at just the point of care testing in general. I hope that we can get to that point.
If we can discuss that when it's properly on an agenda, that would be better.
Yeah, I know, Eileen. I'm just trying to see if we can get that into the agenda item at one point. So because once we propose this and then this law becomes active, I mean, I think it'll be harder for us to add on. So just that's my comments on that.
Okay, duly noted, Song. Point of care testing, and probably what we're going to end up doing is moving this forward just because we need to, the SARS and the flu thing. But I agree that expanding it to all point of care testing and maybe making it broader is something we should add to the agenda for in the future. Ms. Miley, though, based on what he just said and what I've kind of said a couple times is, in B1, the pharmacist completes the testing in a pharmacy licensed by the board. Kind of the feedback that we got on the letter that was submitted by the California Pharmacists Association, and it kind of aligns with what was said during our discussion at our last committee meeting, that the testing might not be specifically within a pharmacy. So when we look at that sentence, is that saying that the testing is specifically within the pharmacy, or could it be in the drive-through out front? Could the pharmacist potentially go to do off-site testing? Can you comment on that?
As for the off-site testing, I think you might want to consider that there are routes that the staff can go to license a mobile pharmacy, but maybe knowing where people are conducting these tests would probably be a good idea, but I would leave that to Ann to talk about. With respect to in a pharmacy licensed by the board, generally we'd have to take a look at, maybe we can play around with the wording if there's a specific section of an address that is the pharmacy, you know, if they're preparing pills and drugs and dispensing those to clients, having it next door to that, you know, maybe it would be, I'd like to hear what Ann has to say about that, but for the mobile pharmacy, if you're going off-site, I think that may be something the board might want to consider, being able, just still keeping it within a pharmacy and having entities that are going to go off-site to apply for a mobile pharmacy license. So that way the board has knowledge of the addresses and who is conducting testing at different places. But I'd like to hear what Ann has to think about that as well.
Sort of, Grant, would you like to comment? Kind of probably my laser focus is on in a pharmacy. And, you know, like our last meeting, people were saying, well, you know, sometimes it's close by the pharmacy, but sometimes it might be specifically not like COVID, it might be out front, it might be the drive-through. So by having in a pharmacy, is that restricting us, or does that allow these other sites on the premises of the building where the pharmacy is located?
So I would say two things. One, I think that really the more important part of B1 is that it's done through an appropriately licensed laboratory, right? And so we're establishing the provisions for a pharmacy to do it under 4119.10. So I would probably need to confer with counsel, but I think that you could, and I believe that you could remove probably that in a pharmacy and really more focus that the pharmacist is completing the testing as, you know, an appropriately licensed California laboratory. And that will do two things. It will also, I believe that there's other provisions of the law that already allow pharmacists to do this in a laboratory, but it will also clarify that piece as well, instead of perhaps creating a problem in our law. And I apologize when I drafted that I did not contemplate that.
So then it would say the pharmacist completes the testing that is appropriately licensed. Is that how? So you just take out that whole. Is that where you'd make the break? The pharmacist. I'm just trying to.
Completes the testing.
Yeah,
but
we would have to smooth
tricky.
the language. Yeah, we would need to smooth that language a little bit, Debbie, but I think that at the staff level, that would probably be what I would recommend to address the issue.
But wouldn't also the problem be that the laboratory also needs to be registered, and that address on that laboratory, would that not be a problem if we go outside of that address specifically?
So I'm totally not an expert, Sung, but what I would say is that under CDPH licensure of the laboratories, they do have models for temporary testing locations as well as mobile testing locations. So I believe that if we focus on the laboratory piece, I do believe that it would give flexibility for those off-site locations as well.
Okay, thank you, Anne.
Okay, I'm going to, just so we kind of stay on task, I'm going to go ahead and open up for any public comments specifically on this part of the specifically on 4052.4. So if you're going to make a comment on the next section, 4119.10, please hold yourself. But is there any other comments around 4052.4? Did we address the concerns that people had of this section? So, moderator, would you please open up the line for public comment?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon, type "I would like to make a comment" into the Ask field, and submit that to all panelists. And our first request for comment comes from Daniel Martinez. Danny, your line is open. You will have 2 minutes.
There it is. Thank you. Danny Martinez with the California Pharmacists Association. We would agree, and as stated in our letter, we would agree to be able to remove that phrase that is problematic. I would make a suggestion for B1 to be able just to read grammatically and have the flow run, would say the pharmacist completes the testing in an appropriately licensed laboratory pursuant to Business and Professions Code 1265, and make it as simple as that. So thank you.
Our next request for comment comes from Keith Yoshizuka. Keith, your line is open. You will have 2 minutes.
Thank you. Keith Yoshizuka, president of the California Society of Health System Pharmacists, speaking on behalf of CSHP. First, I'd like to applaud the board for their vision in expanding this important public health screening tool. And I applaud specifically board member Sung Oh for wanting to investigate all of the other CLIA-waived tests, which is CSHP's position. Case in point, for SB 159, before the pharmacist can furnish PEP or PrEP, we must verify that the patient is HIV-free. So right now, the pharmacist can order the test, even though there's a CLIA-waived test that can be performed. The pharmacist can't do it because we can't get a license for it. It's not within that cadre of tests that the pharmacist can order. As to the restriction for being restricted to a pharmacy, I myself am a laboratory director for the Touro University College of Pharmacy, and there is no licensed pharmacy on campus. It's just the laboratory, and we have outreach clinics at the Vallejo Farmers Market and the Berkeley Suitcase Clinic. If it were restricted to a pharmacy, which we have none, then we would not be able to test the homeless or the medically indigent because we have no pharmacy. So I'm in support of Ms. Sodergren's proposal that just be pursuant to an approved CDPH laboratory license. Thank you very much.
Our next request for comment comes from Daniel Robinson. Daniel, your line is open. You will have 2 minutes.
Thank you. I'd like to just preface my remarks by saying we need to stop asking for things that we're already entitled to do as healthcare providers. It seems that so much of the language that we're dealing with was written originally before we became healthcare providers. And as healthcare providers, there are things that we need to do. We already know that we can perform tests related to medication management, and certainly what we're talking about here is an extension of the practice of pharmacy. If you look back at all of 1206 under clinical laboratory technology, that was all written before pharmacists were providers. And so essentially, any reference to doing the skin puncture was for a non-licensed healthcare provider. And so we, in fact, the people who qualify to do these CLIA-waived tests include physicians, surgeons, anybody licensed under Chapter 6, which would be any nurse or any other healthcare provider that would be using the test for medical purposes. So pharmacists now qualify in that category, and there's really no need for us to continually, it would save so much work if we started thinking of ourselves and making sure the laws reflected that we are healthcare providers. In terms of COVID vaccines, we already have independent authority to administer vaccines that are recommended by APIC. And a simple statement, authority extends to vaccines approved by the FDA under emergency use authorization, would cover us for any additional vaccines that come next year or 3 years from now or 5 years from now. We don't have to keep changing our law every time there's a new virus
10 seconds.
or vaccine. Thank you.
Dean Robinson, I think as far as the vaccine, I believe in a prior committee meeting we did kind of expand that as you, or we're in the process of getting that expanded as you outlined there. And I'm interested in your thoughts on his comments that in the clear waived CDPH in their BPC code, with the understanding that pharmacists are now recognized as medical providers, that we are included in that for all clear waived, which would include these tests. Do you agree with that? I was under the impression that that's not the case.
I believe that I would have to confirm with counsel, but I don't believe that that's the case, and that's why the waiver was pursued. But Ms. Smiley may have some additional information.
No, and I would agree with Ann on that at this point, and also what the commenter said, that some of the statutory language in business and profession codes are making some of these amendments necessary. At one point, maybe when we're not trying to deal with specific issues, is take a wholesale look through all of it with respect to the pharmacist. But at this point, when we're trying to, look at potentially expanding their authority to do some of this, we're trying to work with the language that we have.
Okay. All right. I just want to make sure that we do need to still march forward with this. Okay. Thank you.
And our next request for public comment comes from Paige Talley. Paige, your line is open. You will have 2 minutes.
Okay, thank you, and good morning. I think it's still morning. I'm not going to go into any long harangue like I was initially going to, but I agree with Ann and Danny, and clearly with CSHP's, I think he's the president, right? That since the there's no pharmacy at Toro, but they do pharmacy related stuff, and they are a laboratory, that yes, definitely take out the in a pharmacy licensed by the board. Thank you.
Our next request for comment comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Thank you very much. I also want to first agree with what Dr. Yoshida and the other speakers, Danny Martinez from CPHA, have had to say. I want to emphasize that about 3 decades ago, we changed the definition of a pharmacist under 4036 to specifically say that you can practice pharmacy inside or outside of pharmacy. And this was made because the practice had changed for medication therapy management, for collaborative practice, and for helping the healthcare team manage patients. We have thousands of pharmacists throughout California who practice outside of a pharmacy. They may never dispense a drug, but they still practice pharmacy. They manage therapy, they help with testing and so forth in medical offices, in clinics, licensed clinics and otherwise, in hospitals and outpatient departments of hospitals. And as Toro representative said, they conduct screenings in health fairs all across the state, which are very, very important to the people of California and their health, and especially addressing things like the inequity of health and health disparities of minorities and others. So I would encourage you strongly to remove any reflection in 405.2.4 that it has to be done in a pharmacy. And as long as it's done appropriately by a pharmacist and pharmacy helpers that are acting within the law. And also to remove later, just in case I don't get a chance, to remove any specification that it has to be the PIC, therefore has to be the laboratory director, because a PIC only exists when they're related to a pharmacy. And as Dr. Yoshishida said, excuse me for the name, he is not a PIC because there's no pharmacy at Toro. So I strongly recommend removing the reference as been suggested. Thank you.
Our next request for comment comes from Mark Johnston. Mark, your line is open. You will have 2 minutes.
Thank you. Mark Johnson with CVS Health. I do support all of the comments that have been made before me, such as striking in a pharmacy. I will note that the federal government does not require this to happen in a pharmacy, and neither does any other state in the nation. I also support the comments about expanding this to all CLIA wave tests. And I will just say that there are only 3 other states in addition to California that have a list of CLIA wave tests that are able to be performed. California's is the shortest list. All the other states in the nation defer to the federal government and allow pharmacists to perform all CLIA wave tests. Next, I would like to request that technicians be added, either now or at a future time. There are only 3 states in the nation that do not allow technicians to perform CLIA wave tests, and a 4th if it involves a blood stick. So a technician will be able to do a nasal swab, but not a finger prick in the 4th state. So obviously that also is allowed by federal government. And lastly, I think the way that I look at CLIA wave tests is that there's 2 parts. There's order and administer. Administer is what the federal government allows, and there's no order required according to CLIA wave law. We get stuck in this realm of thinking about, I have a prescription, I fill a prescription. This is different. There's no prescription, there's no order. You can administer a CLIA wave test. Unfortunately, because of third-party billing, we are often required to create an order. And so I'm wondering if the board could comment on the clause, perform any aspect, if that includes order as well as administer. Thank you for your time.
Mark, I'm looking at 4052.4, and I don't see that any aspect language you're talking about.
It's the first line. A pharmacist may perform any aspect.
Oh, I got you. Okay.
Does that include order?
So that your question is, does that include ordering?
Yes.
Ms. Smiley, do you have a clarification of what any aspect could reference?
I would think any aspect would include any aspect that was required. So if an order was required, that would be covered under the language.
Okay, moderator, do we have any other public comments?
We do. We have a request from Lindsay Golohorn. Lindsay, your line is open. You will have 2 minutes.
Thank you. And good morning, Chair Veal and licensing committee members. This is Lindsay Goldhorn with the California Retailers Association and the National Association of Chain Drugstores. First, we do support removing in a pharmacy from section 4052.4, and just want to echo the comments of Danny, Mark, and others who spoke before me. We also want to generally reiterate our support for this proposal for permanently expanding the authority for pharmacists to perform CLIA-waived COVID-19 and flu tests. I think our main point, and I apologize, this is a general point and applies probably to many sections that we're talking about today, but we concur with CVS's suggestion to add pharmacy technicians to this proposal. As you all know, DCA issued a similar waiver in August, allowing pharmacists to perform these tests, and that waiver also authorized technicians to perform CLIA-waived COVID-19 tests. So we just respectfully request that the licensing committee consider adding pharmacy technicians to this proposal, which would be consistent with the DCA waiver, and I believe consistent with the proposal you're considering further down the agenda today to allow technicians to administer the COVID-19 and flu vaccines. Thank you.
And with that, I do not see any additional requests for comment. Would you like me to close the Q&A panel?
Yes, please.
It is closed.
And our agenda item is to expand the authority of the pharmacist to order and administer CLIA-waived tests. That we don't have.
I wasn't listening.
No, the pharmacist texts are not listed on this, so it's not on the agenda, so we can't discuss it. The board can't, but it could definitely decide whether it wants to add that to a future agenda, along with the ability to do all other type of CLIA waived tests.
Okay. Thank you. Okay, board members, based on the comments that we just received, do you want to make a motion around BPC code section 4052 to accept the proposed draft statutory proposal with the one change in section B1 to remove testing in a pharmacy? And we could give the executive officer the ability to make non-substantive changes to allow that to happen. Is there a motion to that effect?
I'll make a motion to that. What you
I
said.
can second that.
Is that Jig?
Yes.
Okay, and I'm sorry, who seconded it?
Song seconded.
Okay, thank you. Any other committee discussion? Eileen,
I don't know if I can make this motion now or later, but I would also like to make a motion to add in the committee agenda on discussing statutory proposal to expand the authority for pharmacists to order all CLIA waive tests.
You actually already made that request, and I already told you we're going to do it.
Okay,
I'll put it on
so
a
we
future
don't have
agenda.
to, okay.
But, you know, asking twice is better than not at all, so it's all good. But yes, on a future agenda, I've already noted point of care testing and also discussing technicians' involvement in it. So we'll put that on a future agenda. Other than that, is there any other board discussion?
Would we vote on that going on the agenda, or it just automatically go on the agenda because of the request?
Yeah, no, I'll automatically make sure it's on a future agenda.
Okay.
Any other comments on the motion? Eileen, did we phrase that up well enough so that we're giving Ann the ability to, and yourself the ability to kind of massage B1 to accommodate what we've been discussing here?
Right, to remove the requirement that the test be conducted in a pharmacy, and it should be in a laboratory license under California. I think you did, and also gave her the discretion to massage some of the language as well to make non-substantive changes.
Okay, perfect.
Yeah, Debbie,
moderator,
if I could, Debbie, I'm sorry, this is Ann, just really fast. So one of the things that I just want to highlight is this is a statutory proposal. So in terms of the language, actually, you know, what even if the board was able to find an author and everything, the language that we would, you know, request might be different than what actually either gets into print because of, you know, changes offered by legislative counsel or the author, you know, that would be moving the measure, like on behalf of the board. So I just wanted to explain that, you know, there is a difference with respect to regulation language where you probably need to specifically delegate things because it's the board's law, but with respect to a legislative proposal, it's a little bit different.
All right, so let me ask you, thank you for that clarification. And with that understanding, since we are going to have to get whatever language we have carried into the legislature, and since there is, I think, a lot of interest in, you know, adding in point of care testing and technician involvement, would we be better served to kind of table this for now and put it on an agenda in the future and incorporate not only SARS and influenza, because we already have the emergency rule. I'm just asking you from a timing viewpoint. So we already have the emergency rule that we can do this testing. Would we be better served to do a broader solution, kind of all as one, versus trying to find an author for this and then the next committee meeting working on a more comprehensive point of care testing solution?
To that, I also have a question, Ann. Yeah,
hey, Song, please let Ann answer my question first, and then I'll let you respond.
I was adding to your question. That's okay.
So I would say, you know, there's a couple of different options. I think we're approaching some legislative deadlines, and you know, we don't know how long the emergency declaration is going to be in place. So if the board is intending to, at a minimum, make the current waived provisions permanent, I would suggest that you move forward with at least a limited proposal now, recognizing that if, you know, should the author be agreeable, if the board wants to expand and the author is agreeable, we could expand it through the legislative process.
Okay, thank you. Okay, Song?
So, you know, I mean, if Ann feels that way, I think I'm totally cool with that. Yeah, I was gonna ask, like, would it be better, like you were saying, can we make this, you know, regulatory, statutory changes a little bit more vague and giving the power for the Board of Pharmacy to draft a regulation? But, you know, I think the timing of it, maybe, you know, we should move forward. So I'm okay with.
Yeah, so okay, so going along with what he just said, what if, I mean, could we in B say a pharmacist may perform any aspects of an FDA approved or authorized point of care test pursuant to the federal clinical laboratory improvement? So remove the reference to COVID and flu. Or we can't do that because of the way we did our agenda and we didn't give people the opportunity.
Correct. The way the agenda was drafted was really for influenza and COVID. But also what Anna said too is if you initiate or try to initiate the statutory process, you know, the author can also try and seek to expand things out to natural expansion. But I kind of agree with Ann, if it's something we want to do beyond, you know, the declaration of the emergency, maybe engaging and trying to find a sponsor for some of, you know, for this change. They can always take up other changes as well later, because it won't happen in a month or two.
Okay. Okay.
Debbie, yeah. I apologize. This is Ann again. So the other thing that I would say is there's a number of stakeholders that are in this, that are participating in this meeting that appear to also believe that it's appropriate to expand it. And I probably just worded that wrong, but through the legislative process, it's just very different than the regulation process. So it's very possible that the author, should we have one, could make changes beyond what the board is envisioning as well, because it really it's their bill, right? We're giving them an idea, and it depends on the author. Sometimes they work with the sponsor, sometimes they kind of take ownership of it. So there's the legislative process is just so different that the board could definitely offer, but stakeholders could also be engaging and making suggestions to broaden as well.
Okay. Okay.
And they're not bound by Bagley-Keene like we are about, the way that we phrase agenda items.
Okay. Thank you, ladies, for your expertise. Moderator, will you please open up the lines so that we can take any public comment on the motion?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the ask field and submit that to all panelists. And we will pause for just a moment. We do have a request from Keith Yoshizuka. Keith, your line is open. You will have 2 minutes.
Keith Yoshizuka for CSHP. And again, I support the board's movement to proceed with attempting to find an author and leaving it to the legislative process for possible future modification of the bill. Thank you.
Thank you for your comment.
At this time, I do not see any additional requests for comment. Would you like me to close the panel?
Yes, please.
It is closed.
All right, I'm going to call for the vote on the changes, the motion, which were changes to section 405.405.2.4. Albert Wong.
Yes.
Gerald Butler.
Yes.
Jason Weiss.
I will have to abstain.
Okay. Jig Patel.
Yes.
Song O.
Yes, I have one more question. I'm sorry.
Okay. Wait. We have to finish the vote.
Okay, go ahead.
And I will vote yes. So the changes to 405 the recommended changes to 405 2.4 will then be sent to the full board. Yes, your comment or question, Song.
Since we are proposing a legislation, do we need to have this go through Leg committee, or can this go to the full board?
No, it goes to the full board.
Okay.
So this will be our recommendation to the full board. And then we'll have to try to find a sponsor for this legislation if the board agrees.
Is that allowed? I mean, I thought any legislation we're proposing has to go through legislation, right? I could be wrong. So if it's appropriate per Ann and Eileen, I'm okay.
I think this is okay. I think it was sent to licensing because it was an expansion on the scope of practice for the pharmacist from what they currently have, excluding the waivers. So I think going forward, once the statutory, if we get a sponsor and we can start moving this forward, then that committee, the Leg will start following it rather than the licensing committee, would be my guess.
Yeah, that's how we've done it in the past. Okay, I'm going to move on to 4119.10 and the changes here. I'm not going to read through it again, I promise. but I do believe that we have incorporated all of the discussion from our last meeting around what we felt like were the requirements for a pharmacy to provide this testing. Once again, we are only talking about the COVID and influenza testing, and an agenda item in the future is expanding to other point-of-care CLIA waived items, as well as technicians being involved, but that's, once again, not part of our agenda, and you know, we don't need to talk about adding those things in today because we can't. The one item I will kind of highlight is one of our prior speakers did make a mention, and I believe it was pointed at 4119.10, item number 3, where it references a pharmacist in charge. I think that was one of the pharmacists in charge references for situations where at a college of pharmacy like Toro, where they would do the testing, but they might not have a pharmacy, and so there wouldn't necessarily be a pharmacist in charge involved. And maybe before we even, I even bring that up and have people talk about that, was that comment relevant? So in order for a pharmacy to obtain a license from CDPH, a lab license from CDPH, is it a pharmacist that obtains it or a pharmacist in charge that obtains it? So can you give any comments about, I think specifically the pharmacist in charge reference in item 3?
Yeah, I think that the difference is this scenario that Dr. Yoshizuka was referring to is not a pharmacy. They are licensed as a laboratory and meet the requirements of a laboratory. He's a pharmacist, but they are functioning as a laboratory under CLIA. What this section is speaking about is specifically authorizing pharmacies to obtain this type of registration for these types of tests. So I think that we might be mixing apples and oranges a little bit. This was to speak about when the testing is happening in a pharmacy, the requirements. So I do not believe that this would apply to the scenario described by Toro because it's not happening as part of the pharmacy license. It's a laboratory outside of a pharmacy.
Got it. Okay. All right. So we don't have to be concerned with item 3. Okay. So with that, once again, I feel like we've incorporated all the comments from our prior meetings and are very meticulous, kind of going through all those questions. But I am interested in what other board members think. So let me just kind of go through the board members. Song, let me start with you.
I'm good. I have no comments.
Thank you. Jig?
I'm good. Thanks.
Jason?
I'm good, thank you.
Thank you. Cheryl?
Yes, I'm good.
And Albert?
You too.
Okay, do I have a motion, and then I'll open it up to the public to accept the addition of BPC section 4119.0 as presented to recommend to the board?
I'll make a motion as you stated, Debbie.
Thank you. And who would like to second it?
I can second that. This is Song.
Okay, thank you. Moderator, would you please open up the comments for that, so we can obtain comments from the public?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first request for comment comes from Danny Martinez. Danny, your line is open and you will have 2 minutes.
Thank you. Danny Martinez with CPHA. I did want to address the other aspect in our letter that we submitted, and I don't know if this would also qualify for a future agenda and not part of this particular agenda item, and that's the issue of the ability to order the non-CLIA wave test, which is currently under the emergency order. So the medium and high complexity tests, pharmacists are able to order those as well and collect the specimens. This permanent authority that the board is considering doesn't include that. So I guess I'll pose the question if that also would qualify for a future agenda or if that could be added into this bill. Thanks.
Eileen or Ann, your thoughts?
It would have to be added to a future agenda because it was not properly noticed. But again, if we open up the legislative process, they can expand or contract however the sponsor wishes to proceed.
Thank you.
Our next request for comment comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Thank you very much. I'd like to just clarify that under California labor law, the term employee and the term employee are two different things. And so I want to make sure that the board intends for this language to also allow a pharmacy to use volunteers or other persons that are not legally employees of the pharmacy. In other words, the pharmacy may employ a volunteer to perform a service without that person being an employee. If that isn't clear, then you may want to clarify it in some way. Thank you.
So Steve, it's specifically that first sentence where it says may employ pharmacists. So would you propose a better word to be like may allow pharmacists?
Certainly, I think that would open it up more and make sure that even not necessarily legal interpretations, but sometimes pharmacies place limitations on themselves. And we have had pharmacists who have already reported that they are willing to volunteer to help with all of the pandemic issues. But the pharmacy organization has said, we can't use you because you're not an employee. And I want to make clear one way or the other that that is not a restriction that we intend in this code section.
Thank you. Ann or Eileen, do you have any comments with whether you feel we should change that word?
I am not in a position to comment on the California labor law, but hopefully Eileen is.
Yeah, I don't know. I think because this is not a reg, I think it's more we can suggest language, but whoever the sponsor is going to go whichever way they want. I think we might want to consider the way it's finally drafted, because although the use of volunteers is a great thing during a pandemic, I don't know, we might want to think through whether we would want volunteers in a non-pandemic type situation. So I think if we can either say may use pharmacists, but I think that's something we'd have to look at the final language for as the board formulates its position on any type of statute coming from the legislature on this.
So
Debbie?
Eileen, in our motion, do we need to add that we will give the executive officer the ability to make non-substantive changes?
Yes, and again, as Ann had said, this isn't exactly like a reg where we have to get the language right. It's just hopefully expressing what the board's views are that should be included in a statute. Once it's taken up by a sponsor, then everyone's going to be commenting on it, including other lawmakers and other stakeholders.
Debbie? Debbie? Yeah, Albert. If they're not employee, if they volunteer, will there be a liability issue?
And
well, there would be potentially, but that would be the. It doesn't say you must. It says you may.
Yeah.
I think that would be the business's decision.
But just to share, the pharmacies has tremendous amount of students that are not an employee of a business, and if that is a problem, then I think that'll cause a lot of confusion. So, I'm more on the side of we probably should not use the word employee.
So I think this was proposed by Jig and seconded by Song. Would you guys be okay with just adding, giving Ann, the executive officer, the ability to make non-substantive changes? Because we might come upon other things as we go through this.
Absolutely. This is Jig.
Same here.
Song, are you okay with that also?
Absolutely.
Okay, thanks. Okay, moderator, do we have any other public comment?
No additional requests for comment. Would you like me to close the panel?
Yes, please.
It is closed.
Okay, let me call for the vote. Albert.
Yes.
Cheryl.
Yes.
Jason.
Abstain. I'll have to abstain on all of items 5 and 6 through this.
Okay. Jig.
Yes.
Song.
Yes.
Okay, and I'll vote yes also. Jason, I understand. I'll still call you just for just for the record. Okay.
Understood. Thank you, Debbie.
Okay. Okay, moving on to agenda item 6 is discussion and consideration of a statutory proposal to expand the authority of the pharmacy technicians to administer COVID-19 influenza vaccine. So the relevant law is currently BPC code 4115 provides that a pharmacy technician may perform packaging, packaging, manipulative, repetitive, and other non-discretionary tasks while only assisting and under the direct supervision and control of a pharmacist. This section further requires the board to adopt regulations that a pharmacy technician may perform. And Title California Code of Regulations Section 1793.2 establishes the non-discretionary tasks to include removing the drug or drugs from stock, counting, pouring, or mixing pharmaceuticals, placing the product in the container, affixing the label or labels to the container, and packaging or repackaging. So the existing law gives the pharmacist the authority to independently initiate and administer the vaccines listed by the Federal Advisory Committee, ACIP, under specific conditions. And effective January 1st, this authority was expanded to include COVID vaccines that are FDA authorized or FDA approved. As part of the October committee meeting and subsequent discussions during the October and November board meetings, the board approved the following policy statements related to the pharmacy technicians administering vaccines. In recognition of the COVID-19 crisis and consistent with the recommendations from health experts, including the CDC, on the importance of influenza and COVID-19 vaccinations, the board supports all efforts to facilitate influenza and COVID-19 administration in a safe manner.
Excuse me, Debbie, there were other things that were noted for the changes for the CLIA waived COVID-19 and influenza testing. Probably
okay. Thank you, Eileen.
If you wanted to
you're exactly right, and okay, we're going to take a break from that. What I was just talking about. In BPC section 120, I have it sitting right in front of me too. 1206.5, there was a change in number 11 to say performing tests is authorized in section 4052.4. In addition, I'm scrolling down here. There were in BPC section 1209, there was also an addition of number E, a pharmacist in charge of a pharmacy serving as the director of a laboratory that only performs CLIA waive tests as authorized in pharmacy law was added. And then, I believe there's one more. Okay, that was it.
Oh, that was it.
So, can I have a motion to accept those two changes in addition to what we've already addressed?
Hi, Debbie. This is Song. I can make a motion.
I'll second.
And
This is
Song,
Cheryl.
why don't we also put in that giving the executive officer
Yep.
okay, the ability to make non-substantive changes. And who was that seconded?
Cheryl.
Thank you, Cheryl.
Yes.
Any other discussion from the committee? Moderator, would you please open the phone lines to see if there's any comment from the public?
This is a moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the ask field and submit that to all panelists. We will now pause for a brief moment. Our first request for comment comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Thank you very much. Debbie, I'm sorry, are you just talking about 1206.5, or are you also including the next one, which is 1209? If so, I'll wait till 1209.
No, I did both. I put them both together.
Okay, then my comment on 1209 is we still have a problem with subsection A2 capital E, where it refers to a pharmacist in charge. And it may be interpreted then that the only pharmacists that can serve as laboratory directors are pharmacists in charge. So I suggest you change that to a pharmacist serving as the laboratory director.
And what I know when we did pharmacist in charge and when we talked about pharmacist in charge in the prior discussion, I believe your comment was that this is as it relates to a pharmacy and not just a lab doing the, just as a lab director. When we're talking about 4119.10, what are your thoughts here? Do we need to consider changing this just to a pharmacist?
So I would say that in general, pharmacy, the PIC is responsible for all of the operations of a pharmacy, right? The PIC is responsible, and this is kind of doing that same provision, but it's explicitly allowing for purposes of designating the laboratory director, of which there's very strict requirements, that a PIC can fulfill that if it's a pharmacy that is seeking the licensure as the laboratory.
Okay, thank you. Are there any other public comments?
There is. Our next request is from Daniel Martinez. Daniel, your line is open. You will have 2 minutes.
Thank you. Danny Martinez with CPHA. I actually would echo Dr. Gray's comments. I think the label of a pharmacist in charge of a pharmacy as a person who is authorized to be named as a laboratory director does create problems. In addition to previous testimony of folks who are not PICs who are operating these these clinics, I should say, we also have members who are doing so in schools, in places of business, and that kind of thing, where they're not necessarily the pharmacist in charge. So I would echo Dr. Gray's comments and ask that the board consider changing that to a pharmacist serving as the director of a laboratory performing CLIA waive tests authorized in pharmacy law.
And at this point, that was our last request for comment. Would you like me to close the panel?
Yes, please.
It is closed.
Okay, I'll call for the vote. Song-O.
Do I need to change my motion, Debbie, to add that comments about pharmacist, or can I?
So I think if you want to change it, let's see, Cheryl seconded it, but I think Ann said that we don't need to do this, but
Okay, well, if that's the case, I'm okay. I'll keep my motion. I'll vote yes.
okay. Jig,
Yes.
Jason,
Abstain.
Cheryl,
Yes.
Albert,
Yes.
and I will vote yes. Okay. So I am going to go back to, I apologize for that oversight, and thank you, Eileen, for pointing out, but we didn't get ourselves into trouble. I'm going to go back now. I'm going to read the policy statement regarding the expand authority to allow pharmacy technicians to administer COVID-19 and influenza vaccines. In recognition, and this was approved by the board. This is the approved policy statement from the October-November board meeting. In recognition of the current COVID-19 crisis and consistent with the recommendations from health experts, including the CDC, and on the importance of influenza and COVID-19 vaccinations, the board supports all efforts to facilitate influenza and COVID administration in a safe manner. Further, in recognition of the unique access patients have to community pharmacies, such locations provide a safe and convenient option to receive such vaccinations. The board further believes that influenza and COVID-19 vaccine administration may be safely performed by a specially trained licensed pharmacy technician under specified conditions, and as such supports efforts to secure such temporary authority under waivers during the declared disaster, as well as more permanent solutions through statutory or regulatory changes. So with that policy statement, and during this meeting, we will have the opportunity to review the draft statutory proposal. As drafted, the proposal includes the prior provisions identified by the committee as appropriate. Specifying the task must be delegated by the supervising pharmacist, completion of training program approved by ACPE and CPR certification, ongoing requirement for 1 hour of CE, authority to administer epinephrine if delegated by the supervising pharmacist, and record-keeping requirements. So once again, we're working just like we were on the prior one. This would be this draft statutory proposal that we would then present to the full board. If they approved, then we would try to find an author to carry this idea. Maybe not exactly our language, maybe they would, so that's what we're, that's the discussion of this agenda topic. I do want to just mention that agenda topic 7 is where we will just determine if additional vaccines are appropriate for pharmacy technicians. So let's not discuss it under this agenda topic. We can have a discussion under agenda topic 7 if we want to expand to other vaccines. So with that, I'm looking for, so the proposal to amend section 4115 of the Business and Profession Code. I'm sorry, I'm flipping through here. So it comes to item J is where it would be added. And if you look in your material, it says a pharmacy technician may administer a COVID-19 or influenza vaccine if deemed appropriate and delegated by the supervising pharmacist if the following conditions are met. 1, the pharmacy technician holds a current certification in cardiopulmonary resuscitation or CPR. 2, pharmacy technician has completed a training consistent with a minimum of 6 hours of training, which includes live training, assessment, and evaluation of injection technique assessment, and completing the online assessment and evaluation from an ACPE accredited provider. Number 3, the pharmacy technician completes 1 hour of immunization-related continuing education once every 2 years. 4, if deemed appropriate by the supervising pharmacist, a pharmacy technician may also administer epinephrine. 5, the pharmacy maintains a record of the identification of the pharmacy technician administering the vaccine and identification of the supervising pharmacist. So that's the proposed statutory language that is consistent with the criteria that we discussed for the waiver. So with that, I will open it up for board members to make comments. Let me start with Song O.
Hi, Debbie. So I think that this, is already going on with the waiver. COVID-19 vaccinations are being allowed by pharmacy technicians. I think we don't need to rush into proposing these legislations yet. And also on top of it, we do have workforce survey, and we should evaluate how things are actually going and then go from there. So I don't think that this is necessary at this point for us to propose legislation.
I guess my only, as part of the policy statement by the board is that we would pursue a more permanent solution. So I guess perhaps let's hear from the other board members and see if others feel the same at this point. Jit Patel.
Well, I'm in support of this, and I think pharmacy technicians are doing a fantastic job. Having 19 technicians under my supervision and getting firsthand feedback, I'm hearing nothing but absolute, satisfaction of being able to participate more and empowering them to give other vaccines like influenza and for future discussion, maybe all other vaccines. I think it's going to be great for residents of California, especially during pandemics when we need to immunize at a faster pace. They can definitely help our pharmacists. So I'm a big supporter of this. It's making a huge difference out there.
Can I ask if any of your pharmacists have had if they have any concerns? And
yes.
do you give pharmacists the ability to choose which technicians that they, deem appropriate?
Absolutely. There was one case where a pharmacist didn't feel comfortable with the technique. So, we just had to politely let the technician know that you won't be able to immunize, and providing more training if needed, and just getting some feedback. And at the end of the day, it's going to be the technician's call if they want to administer, and it's going to be the pharmacist's call if they would allow this trained technician to immunize. So, but other than one case, I had no other issues so far.
Hey, Jake, I have a question actually. How is the company handling the liability protections for pharmacy technicians and pharmacists?
Absolutely. The company is liable for every employee, I believe. For anybody that works for a company is a personal liability. They will be there for that employee. Just like right now, if a pharmacist makes an error and there's a big lawsuit for a major corporation, it's the corporations that usually come out and defend them. Every company is different, but that's how it is usually. In case of independent pharmacies, obviously it will be the pharmacy owner's responsibility and their general liability license that would cover that as well.
Thank you, sir.
Thank you, Jig. Jason.
No, nothing at this time. Thanks, Debbie.
Cheryl.
Yes, I have to say I agree with Song on this. I think that, we have a waiver, and with that waiver, we can, we have time to get data to see how this goes. I talked to a number of pharmacists throughout all the chain stores, and the pharmacists right now are overwhelmed. They're having to give these vaccines every 15 minutes. They're not getting any extra help. And to add this right now, we have a waiver. We can do it. I think we should to hold off on this at this time.
Okay, thanks, Cheryl. Albert.
Yes, that's what my concern at the very beginning. I say I support the technician and or the pharmacy doing all this testing, but they should provide enough help, to provide those tests. So that's one of my main concern. They don't get enough help.
Okay. Moderator, can we open up the line for public comment?
Debbie, do you want to see if there's a motion that maybe, so you don't have to open it up twice to public comment?
Actually, I wanted to see if we can get stakeholder comments before we do that.
That's okay.
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the... My apologies. Please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and submit that to all panelists. Our first comment comes from Lawrence Louie. And Lawrence, your line is open. You will have 2 minutes.
Good afternoon, Lawrence Louie on behalf of UNAC UHCP, United Nurses Association of California, Union of Healthcare Professionals. I've been a pharmacist for 30 years, and I want to express my concern and opposition to this proposal. While I understand the effort to allow pharmacy techs to administer the flu and COVID-19 vaccines during the current emergency order, I don't think it's appropriate to take advantage of emergency waivers in a global pandemic to push for a permanent change in policy. As we're careful in how emergency waivers are used, we understand they are temporary and in effect to deal with an immediate need, we certainly shouldn't rush an emergency temporary waiver into law. As we look at waivers in other licensed professions, the patient to nurse ratio comes to mind, which is in California, the strongest in the nation, and it receives strong bipartisan support in the California legislature. If there were a proposal to make permanent the ratio waiver change now, I too would be concerned and opposed. This proposal before us today is something that should be discussed in the future once the emergency order and waiver expire. This is not the time, it's premature.
Thank you for your comments.
Our next comment comes from Denise Tugati. And Denise, your line is open. You will have 2 minutes.
Thank you. Good afternoon, Denise Tugati with SEIU United Healthcare Workers. UHW represents several thousand pharmacy technicians across the state, including at large systems like Kaiser, Dignity, and Sutter. UHW appreciates that the need for professionals to fill this need for administration of vaccines on a temporary basis. However, echoing board members O, Butler, and Wong, want to express our concerns given how far outside this work is from the normal scope of pharmacy technicians, without having proper evaluation of what the outcomes are, and other issues. And so I want to echo the thoughts of the previous speaker as well, and ask to delay putting these changes into statute, it seems premature given that the current waiver is still ongoing. So thank you so much for your time. And I expect that UHW will have similar thoughts around other agenda items. Thank you.
Thank you for your comment.
Our next request for comment comes from Jazzy Graywall. Jazzy, your line is open. You will have 2 minutes.
Can you all hear me?
Yes.
Good afternoon, Chair and board members. My name is Jazzy Graywall, and I'm with UFCW Western States Council, speaking on behalf of our pharmacists and pharmacy technicians in the drug retail setting who are unable to be here today due to the overwhelming amount of work the pandemic and the recent COVID-19 vaccinations have caused. For 2 reasons, we strongly oppose this premature statutory proposal. First, DCA just recently issued an unchallenged waiver to allow pharmacy technicians to administer vaccines. Therefore, a bill is not needed to address this while we're in a pandemic. Second, the recent waivers and changes issued by the board and DCA, according to calls and messages from frightened and angry pharmacists inundating our leaders in LA County, has caused dangerously chaotic situations in community pharmacies administering COVID-19 vaccines. Notwithstanding the staffing orders permitting greater ratios, we have not seen pharmacy technicians staffing increases to handle the distribution of the COVID-19 vaccine and testing. At one large grocery chain in LA County, it has been reported that pharmacists who continue to work 12-hour shifts alone are responsible for administering a COVID vaccine every 15 minutes throughout the whole day, leaving no time in between appointments for breaks, to monitor allergic reactions, or to complete any of the other tasks that pharmacists are responsible for, like filling prescriptions. The recent addition of 65 and older adults for vaccine priority has overwhelmed and backlogged pharmacy phone lines and in-person lines, with individuals trying to reserve a vaccine appointment, making it difficult for doctors and prescribers to reach the pharmacist to order prescriptions and refills for sick patients, ultimately compromising patient safety. Store managers have instructed pharmacy staff to not cancel vaccine appointments, leaving the lone pharmacist to have to choose between vaccinating patients or filling prescriptions. Some pharmacists have deemed the conditions in the pharmacy so unsafe, they defied the demands of store managers who threatened them with being fired and canceled vaccine appointments to attend to the dire backlog on prescription refills, often not being able to meet the arbitrary quotas instituted by those chain pharmacies.
10
Therefore,
seconds.
for all these reasons, we strongly oppose any statutory change at this time. UFCW would also like to echo support for the comments made by UNAC and SEIU UHW. Thank you.
Our next comment comes from Keith Yoshizuka. Keith, your line is open. You will have 2 minutes.
Keith Yoshizuka, speaking for CSHP. I speak in support of the action to introduce the statute. As will be discussed later, I also believe that it should be expanded to any immunization ordered by the pharmacist. And that's it. Thank you very much.
Our next request for comment comes from Paige Talley. Paige, your line is open. You will have 2 minutes.
Okay, thank you. I hope to be brief, less than 2 minutes. I've chair and other committee members, I've always opposed having pharmacy technicians providing vaccinations. But, we're resigned, California Council for the Advancement of Pharmacies resigned to the emergency waiver. But we do agree with all of the previous speakers except for CSHP in that it's just too much too soon now. And you do have the waiver in place. And I think we need to wait and see. We need more evidence of what's happening. Thank you.
Our next comment comes from Lindsay Gullahorn. Lindsay, your line is open. You will have 2 minutes.
Thank you. This is Lindsay Goldhorn with the California Retailers Association and National Association of Chain Drugstores. As we've stated in prior committee meetings, we are in strong support of permanent statutory authorization for pharmacy technicians to administer the flu and COVID-19 vaccinations. As we have all seen, rollout of the vaccine has been very slow in California, and that is the priority right now for all of our policymakers, is getting these vaccinations in people's arms. And while supply is the first concern, having the healthcare personnel available to administer the vaccine is another primary concern. Even after the pandemic, pharmacy technicians will be needed to preserve the public health and get flu and COVID vaccines administered in our communities. Also, just want to point out that this is a statutory proposal, so if the board does decide to continue to pursue it, there will be a robust legislative process with additional time to weigh in. So we are hopeful that we can continue to have discussions with the board regarding this policy, and we thank you for your work on this important issue.
Thank you for your comment.
Our next comment is from Mark Johnston. Mark, your line is open. You will have 2 minutes.
Thank you, Mark Johnston, CVS Health. Prior to the pandemic, there were 5 states who allowed tech immunizations. There were also 2 states that had statutory authority for tech immunizations, waiting on the board to promulgate rules. Since the pandemic, I'm aware of at least 3 additional states that have enacted permanent allowances for tech immunization. So now we're up into double-figure states. This certainly is not an item that needs to wait to look at data if you just rely on other states. California used to be at the front line of pharmacy change, but now it seems like you're playing catch up a lot. I am a bit befuddled by the comments that I hear that explain conditions that need help, but are not willing to accept this help. This is help. These are technicians helping the pharmacist give immunizations to better public safety. Really, what I hear are comments that scream for an increased ratio, which would be the biggest help. Many technicians that could help with immunizing per pharmacist. Thank you.
Thank you for your comment.
And our next comment comes from Rob Geddes. Rob, your line is open. You will have 2 minutes.
Hi, thank you very much. This is Rob Geddes on behalf of Albertson Safeway Pharmacies. Very appreciative of the opportunity to speak, and we also would like to strongly support this, that it goes to the legislature to foster and potentially become permanent statutory change. As I've mentioned in previous meetings, we have utilized technicians were allowed prior to the pandemic, and have gone forward with training technicians where we've been able to, throughout the pandemic, under the HHS guidance, as well as this waiver in California. Our experience has been extremely positive. The technicians are some of the most helpful individuals within a pharmacy, and it truly does take the burden off of the pharmacist to carry that weight alone. I would also like to just expand upon, there's been several comments regarding 15-minute scheduled immunizations. The other side of this conversation that has not been discussed is the challenge of being able to ensure that we have social distancing within the pharmacy, and that the pharmacies are not inundated with individuals standing in lines waiting for the vaccinations. So rather than viewing the 15-minute schedule as a quota, it's more a tool to prevent our pharmacies from being overrun and being able to safely administer in social distanced manner, so that the pharmacists can safely and have the assurance that they're going to be able to be protected and not have mobs of people standing in front of them. Again, support this, agree with the comments made by Lindsay and Mark Johnston, and would like to see this continue forward. Thank you very much.
Thank you for your comments.
Our next commenter is Stephen Gray. Stephen, your line is unmuted. You're ready to go for 2 minutes.
Thank you. speaking as an individual, I strongly support this going forward. It will go through the legislative process, and there will be time to consider all the concerns that have been expressed today. One of the concerns might be that needs to be addressed as it goes forward is I believe that under federal law, there is a specific requirement that the pharmacist that is supervising pharmacy technicians is himself or herself also qualified with proper education, training, and experience to administer immunizations. And you may want to consider adding that language to this either now or later in the process. I also want to echo what we know from at least one other state, that this addition of flu vaccine in the long term has had a very favorable effect on the inappropriate use of antibiotics in cases where it was a virus and not a bacteria infection. That is very important because we are losing the ability of our antibiotics to be effective at a rapid pace. So I would suggest, I do support this, and I suggest considering that modification to the language that I just mentioned. Thank you.
Thank you for your comment.
Our next comment is from Danielle Tran. Danielle, your line is open. You will have 2 minutes.
I am representing a large corporation in NorCal, and as a pharmacist for community pharmacy, as well as a immunizer trainer for a technician. We have had this is our second week having technician giving immunization to the public. It has gone very, very well, better than I expected. We have had technicians would come to me and telling me how rewarding and how valued and how empowered they have felt within the last week of giving immunization. On top of that, as a pharmacist, training these technicians, I can see how valuable they are going forward for the pharmacist. I've been able to concentrate on giving consultation to the public, as well as be able to oversee the tasks that my technicians being performed under my supervision. Therefore, I strongly urge that this will be more moving forward in the future, as this will be a huge initiative for myself and for my technician to feel valued and empowered, and being really helpful within the pandemic that we have going through right now. Thank you for allowing me.
Thank you for your comment.
Seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Okay, do I have a motion from any of the board members in regards to the statutory proposal?
I would like
I'd like to make
motion. Sorry, can I?
Oh. Go ahead, Jake.
Okay, all right, sorry. If you had a comment, go ahead. I was going to make the motion.
No, I was going to make the motion too, but it's okay. You can go ahead.
Okay, I would like to make a motion to pass the statutory proposal to expand the authority for pharmacy technicians to administer COVID-19 and influenza vaccine.
Okay, so to recommend to the board.
Yes.
Is there a second? You know, I'll go ahead and second it just so we can get a vote. Is there any other comment by board members before we? Is there any other comment from the public?
This is the moderator. We have again opened the Q&A panel. If you'd like to make a final comment on this item, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the ask field and submit that to all panelists. Our first comment is from Stephen Gray. Stephen, your line is open.
Thank you again for allowing me to comment. As I mentioned earlier, this is a very important action to go forward. And I think it's so important that it needs to go before the entire board. And I would suggest that if this motion fails to go forward with recommended support, that a motion follow it to give the entire board the opportunity to discuss and weigh in on this very important aspect. It's important not only for the current crisis, but going forward for future situations. Thank you.
Thanks for your comment. And yeah, the board, regardless of what happens, the board would have the opportunity to weigh in on this for sure.
Our next comment is from Jazzy Graywall. Jazzy, your line is open. You'll have 2 minutes.
Hi, thank you. Thank you for allowing me to make comment again. I would urge the board to oppose this motion and continue to discuss the statutory proposal, given that there is still a workforce survey that needs to be released to be able to see how does staffing look like in the community pharmacies across the state, and would really urge the board to consider pulling this back for further discussion. There's a complete lack of worker protections in this proposal that needs to be there: anti-retaliation protection, protection for the pharmacists and techs who might refuse to do this work because they deem the conditions unsafe, the right to refuse unsafe work. So there's a lack of protections for the pharmacist in this proposal if it were to move forward, and just really urge the board to continue to have further discussions, given that there is a waiver in place and we do have the time to be able to have those discussions throughout this pandemic.
Thank you for your comment.
Seeing no further requests for comment, would you like, oh, sorry, one more popped in. Daniel Martinez. Danny, your line is open. You'll have 2 minutes.
Thank you. Danny Martinez with the California Pharmacists Association. This is obviously a very sensitive topic, as we all can hear. I want to say from the association's perspective, we did pass policy at our most recent House of Delegates that supports having pharmacy technicians administer the COVID and flu vaccines with the appropriate training and under the direction of a supervising pharmacist. In that sense, we are in support of this proposal. However, I do want to note, and I think the board should be having more conversations on the following of what I'm about to say, is that this will add the increasing number of vaccinations will increase workload upon supervising pharmacists who are responsible for overseeing the technicians. I don't think there's enough attention being put to that aspect. And I think, in this, clearly this is an immediate healthcare need. This COVID is not going away, next week or in a month. So there will be a need for this. And, as COVID tends to, as we see mutate, we might see new strains and we might be in the middle of another pandemic next year. So per our policy that we have passed, we are in support of this proposal. It does hit on all the points that we've made in our policy. But I really, really would ask the board to consider how much of an increased workload this will play on the pharmacist. Thank you.
Thank you for your comment.
Next comment is from Lindsay Golohorn. Lindsay, your line is open. You will have 2 minutes.
Thank you. This is Lindsay again from CRA and NACDS, and I want to reiterate that there is a legislative process that this would go through. The bill introduction deadline is, I believe, February 19th. So I think it is in the best interest of the board to, or the committee at least, to pass this to the full board today. I agree with Steve Gray. Like Danny said, COVID's not going away. So I think this is something that we need to consider now. And there will be time when the legislature considers it to have more time to weigh in. There will be oversight and more stakeholder involvement. So I just urge the committee to consider passing this to the full board today. Thank you.
Thank you for your comment.
And that appears to be our last request for comment. Would you like me to close the panel?
Yes, please.
It is closed.
We had one comment to make to the board member, to the committee members.
Sure.
Based on some of the comments we heard today, that we are rushing into it or it's premature. I feel we are not rushing into this. We are not taking advantage of the pandemic in any way or form by giving authority to and training our pharmacy technicians to administer COVID vaccines and allowing to give other vaccines. We are preparing California to be better prepared for disaster. It's been a goal of the state for disaster preparedness, and this is one step the board can do to improve the preparedness. When all licensed individuals in pharmacy are empowered to provide the services, it does help with the workload that a pharmacy has. If the pharmacist is the only person that can give shots, and now after the initial screening and consultations that's required, if the technician can take care of the process, it helps. It's not the added burden. It improves the efficiency of the pharmacy. And during these times, you see local jurisdictions, the counties are trying to rehire retired employees. I saw a blog in the Bay Area, Alameda County to be precise, trying to get more volunteers to sign up so they have enough immunizers during these mass clinics that they're trying to take care of. And I think what we are doing here, it's going to prepare the pharmacy workforce to be prepared for any disasters to come in future. Thanks.
Thank you, Jay. All right, let me go ahead and call for the vote. Song.
I vote no.
Good.
Yes.
Jason.
Abstain.
Cheryl.
No.
Albert.
No.
Okay, I vote yes. So that's 3-2. So a recommendation to the full board. We'll not be sending a recommendation to the full board. Let's see, at this point, Sung, was there another motion that you wanted to make, or did that resolve it?
I wanted to make a motion that we table this issue for now and to wait for the workforce study to come back, and that we can have a further discussion on this topic after the survey comes back.
I second.
Thank you, Albert. And to that point about what Mr. Dr. Jig was saying, I just wanted to say for the record, and to some comments that was said from the commenters earlier, I wish it was the case that there's plenty of pharmacy technicians that are available for pharmacists to utilize, but the real world out there again is that they hardly have a person to spare to do anything else to do their job. So pharmacists are so spread thin, pharmacy technicians, I wish they're actually there, but so many pharmacists work in an environment where they do not have a pharmacist technicians to get any help from. I just wanted to put that out there for the record.
Thank you.
And
Is there any other board comments?
I'd just like to also just say that I agree with what Song was saying. And, again, we have a waiver that allows this. We have time to get information back. I mean, and I just want to know, how is this going to make the pharmacy safer? I mean, this is you know, when I think about what's going on now, what I'm hearing that's going on in all the stores right now, our mandate is public protection. And, you know, yes, and then most of the techs I'm talking to certainly are saying that this is not something that they want to do, but at this point, we have a mandate, and let's, again, wait. This is, as far as I'm concerned, premature, and I think, like Song say, we can continue this discussion.
Yeah, this Albert. Yeah, I agree with both of them. Since the waiver is already in place, I'd like to see how it go first, and then we don't need to rush it, and we could come back and entertain this in the near future when the pandemic is over. So I am for the technician to help out, but we could do that with this decision later.
Okay, thanks for everyone's comments. I actually think we should be moving forward with this because you know, if we wait until after the pandemic's over, then we're gonna, you know, talk about it. So it's just a legislative process. So, I mean, even moving it now, we're looking at probably a year or two out. And so by holding off, I just think we're pushing it down the road. And as one of the commenters said, California used to kind of lead the nation in innovation. I feel like on this one we're not. But is there any public comment? What I'd like to do as far as the public comment, if you've already stated your position, like we know most, you know, who's in favor of this motion, and we know who would prefer that we not move forward. If you have something new, is what I guess is what I'm trying to say. You know, we want to hear your comments. But we don't need you to just restate what you've already stated.
Thank you, Debbie. Yes? Thank you, Debbie, because I mean, we're hearing from the same people saying why they support. So.
Right. But we have a motion, and so we do have to open it up to the public. And so, moderator, yes, please open up for public comment.
This is the
public comment.
Yes, this is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and submit that to all panelists. And we will have just a brief moment of pause. We have a request for comment from Rob Geddes. Rob, your line is open. You will have 2 minutes.
Thank you again, Rob Geddes with Albertson Safeway. Just to make a quick comment, I think this week we had a very good example of how quickly a waiver can go out the door with the governor rescinding his stay-at-home orders. Everything that was related to those stay-at-home orders was officially lifted. And so what I would like to caution against is the irresponsible decision to table this for the fact that it would, just like Debbie mentioned, it will prolong the process with a very important decision that needs to be handled by the public and also the legislature. This decision is something that can help and benefit the public safety of California, and I believe that tabling this issue would be catastrophic to the progression of the response to the pandemic. Thank you very much.
Thank you.
Our next comment comes from Stephen Gray.
I thought we were not going to continue to hear.
Stephen, your line is open. You will have 2 minutes.
Hi, this is Stephen Gray. Thank you. This is representing myself. I have something to consider. The motion on the floor, as I understand it, is a motion to table until the workload report is received. I think that the committee needs clarification as to what passing that motion would mean. Would it mean that even at the next meeting of the committee, if that report is not received, that this cannot be discussed? Is it going forward as a motion to the full board for them to table the discussion? I think there needs, before people vote, I think there needs to be an explanation as to what the meaning of that motion is. Thank you.
Steve, so it will go to the full board, and the full board can override this motion. But I would like to have a clarification, and perhaps you can help me with this because I believe you're the one who made the motion. What workload report are you referring to?
It is in our agenda, in couple items down the item. We are having
The
the
pharmacist workforce survey?
Yes.
Debbie, I thought, excuse me, Debbie, I thought that this would stand to committee and not go to the full board until the committee made a decision.
So all the committee can do is we'll send it to the full board, and we'll report out that the recommendation of the committee was to table it. However, the full board can override it.
Okay, so that's what happens in all situations like this?
Right. So the committee doesn't really. We only make recommendations to the full board, and then the full board can either accept them, they can reject them, or they can modify them.
Okay. And for those people who say that they don't agree, then we're saying we don't, I'm saying that I don't agree with what they're saying. At the end of the day, our mandate is public protection, and California set a standard. So that's how I feel about it.
Song, in this case, should we withdraw this motion?
This is the moderator. We still have additional requests for public comment.
Yeah, I think, or I can change my motion to table this issue. Just that.
So if both the first and the second are pulling back their the motion, then Eileen, can we just table the motion? Or do we don't still need to vote, right? If both the first and the second
if the first and the second withdrew the motion, there's no motion pending.
Okay.
So it would just be the question what you would put in the report. The first motion was voted down, and so the committee doesn't have anything to report to the board, and the board can take it up, say, just as you had said before, they could agree with it, they can disagree with it, they can discuss it.
Okay.
But, excuse me, Debbie, I thought that a Song did make a motion, and we did second it, and we did vote on it.
The Song made a motion. I think it was Albert seconded it. We had our discussion. Now the public's talking about it. We have not voted on Song's motion. We voted on Jig's motion to accept the statutory change, and that was voted down 3-2. So now we're on our second motion, and it sounds like Song and Albert are considering withdrawing the motion.
Well, can I change my motion to just table this issue then?
So you want to change your motion from waiting for the workforce survey to tabling it. I mean, it seems like if you have a motion, there needs to be an end date. So I think either you have a motion that you wait for some sort of workforce survey, or you withdraw the motion.
Well, I'm honestly fine with waiting till workforce survey comes back. I think that will give us a very good insight into what's going on in California community pharmacies. And we have no real understanding of what's going on out there. And with all due respect to all the commenters, we don't know, nobody knows. So we need to have a better understanding of the situation that's going on. And so I think that'll be greatly beneficial for all of us to have a better understanding and to be able to move forward. This is not something that we need to rush to. There are already pharmacy technicians immunizing COVID vaccinations. There are plenty of pharmacists out there that can help out. So I think that I would like to stay on with my motion to table this issue until we have a workforce survey is out.
Okay, and you understand the workforce survey is not about this specifically, right? I just want to make sure you understand that.
I understand, but I also, that's an item down
Okay.
the line. So, you know, that was something I wanted to bring up is about we need to include some other issues into that workforce survey. So that's why I'm bringing that up to this issue because they're tied together.
A
Okay,
song.
we'll wait. Okay, we'll wait until we get there. Okay, so the motion stands, and do we still have a public comment?
Yes, we do. We have a
Well,
request.
there's no second yet on that one.
No. No, it's the same motion, Albert, unless you
Same
withdrawing
motion.
your.
Song, if you motion it, then they will have to go to the full board and they could take that up. So if we don't send any motion up there, then we could evaluate that later on a later date.
Well, I think, Albert, actually the full board could decide to make a motion, even if we don't have a if on this topic we have no recommendation and that's what will be reported, that doesn't preclude the full board from making a motion. So whether we vote on this, whether this motion exists or not, it's, you know, this agenda item will go to the full board.
It will be the last motion. It was the last motion, the first motion that go to the full board.
The whole agenda topic goes to the full board, and so the full board will know that the committee voted down the motion to move it forward.
Yeah.
And so the current motion is to hold working on a statutory solution. I mean, that our policy says we're going to work on a statutory solution. So at some point we have to do it. So so the motion right now is that we're going to hold off working on the statutory solution until the pharmacist workforce survey is completed and we can possibly use that as a decision-making tool. So that's what that was his motion, that's what you seconded. So are you still want to second that?
Yes.
Okay. All right, I think we still have a public comment.
Yes, Robert Stein would like to make a comment. Robert, your line is open. You will have 2 minutes.
Hi, Robert Stein, speaking as an individual. I'm really fascinated by the arguments that because there is, currently a waiver.
We just lost you, Robert.
Oh, can you hear me?
We heard that you're speaking as an individual, then you went.
Oh, okay. Can you hear me now?
Yes, we can.
Okay. Yeah, I just want to say that I'm a little confused by the arguments that because there's a waiver in place that there's no need to move forward with a statutory fix for this. There may be a time when the emergency is no longer officially declared, but there still are lots of people that need immunizations. And so I guess my question, and we heard from another commenter that technicians are already doing COVID vaccinations, at least in some community pharmacies. So I guess my question is, if there's a danger that's perceived in moving forward with allowing this, why is it allowed right now under the waiver? And again, the protection of the health and safety of Californians is really the responsibility of the board. And it seems to me that more vaccinators is actually a good thing, not a bad thing. And it does not force any pharmacist or technician to actually do immunizations. It's permissive. Thanks.
Thank you for your comment, Robert.
And seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
All right, I'm going to call for a vote. Albert.
Yes.
Albert?
I say yes.
Okay. Cheryl?
Yes.
Jason?
Abstain.
Jig?
No.
Song?
Yes.
I vote no. So the motion carries 3-2. We still have a couple items on the agenda. However, I'm going to do a quick bio break. So it's 12:51. At 1 o'clock we'll reconvene.
What time are we coming back again? I didn't hear it. Sorry.
1 o'clock.
1 o'clock.
Okay.
So you got 9 minutes.
Trump administration.
Jason White.
We heard from Secretary Blinken. Vows to really restore traditional.
Cheryl Butler.
Here.
Albert Wong.
Here.
Let me try Jason. Jason, you here? Okay, the next agenda item 7 is discussion and consideration of board's current policy related to the authority for pharmacy technicians to administer vaccines to determine if inclusion of additional vaccines is appropriate. So, you know, I guess it really just, the question is, do we want to expand the policy? And I don't really want to put words into people's mouths, but it seems like if we, you know, do we want to perhaps combine this with the prior discussion, and at the point that we decide to expand the authority for technicians on flu and COVID, we would include in the discussion the other vaccines?
I personally would not like that to happen. I think that just like someone spoke about the waivers, is it like a proof that things are okay? The waiver just went in place and we're still getting information back. I certainly don't think we should be adding other vaccines at this point.
What do you think about my thoughts, though, that we kind of combine the two subjects together? So they all kind of get, you know, right now, where we kind of have them as two separate discussions. I'm wondering if we kind of merge one discussion and we have that discussion at some point in the future.
I think that's fine, Debbie.
Okay, any other, so I heard from Song and Cheryl, Albert, Jason, or do you have any thoughts on?
Yeah, combined together is okay with me.
This is Jason. I concur.
Okay.
Yes, me too.
Okay, thanks, everybody. I don't think we need to make a motion on this. Ann, tell me if I'm wrong.
I think you should make a motion and just say that you're going to combine these two items together and just vote on it that way, but first open it up for public comment.
Okay. Does anyone want to make the motion?
I can make the motion, Debbie, to combine the two topics.
Okay, that was Jig? Or was
Sorry,
that
that was
Song?
Song. Sorry.
Okay, sorry.
I'll second. Jig will second.
Do I have anybody to second that?
Jig will second.
Okay, thank you. Do we have any public comment?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and submit that to all panelists. Seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
All right, let's go ahead and vote. Albert?
Yes.
Cheryl?
No.
Jason?
Yes.
Jig?
Yes.
Song?
Yes.
And I'll vote yes also. So the motion carries. Item number 8 is discussion and consideration of draft pharmacist workforce survey. As indicated in the board's response to sunset issues, the issue of medication errors must be addressed to improve patient health. The issue warrants study in California where conditions within a pharmacy may be different than on a national level. Further consideration should be given to determine if the board or some other entity should receive reports of medication errors to gain better understanding of the scope of issue and report on the findings. It appears appropriate to conduct a survey on working conditions to ascertain if conditions in California may be a contributing factor. So one of the items that was sent out in our media materials was a draft workforce survey, which was put together in collaboration with our board staff and an expert from the Department of Consumer Affairs. Anne, is there anything you want to add to this before we kind of take general comments on the survey?
No, but thank you.
Okay. So I think what we're trying to understand is, if you had a chance to look through the survey, I think, Song, you actually indicated that there might be other things you would like to have potentially added. Anyway, that's kind of the feedback I'm looking for is, did we hit on the right items? Is there other items that need to be added? And then we can kind of, hopefully, Anne can give us kind of some guidance on what would be appropriate and what wouldn't be. So, Song, I'll go to you first because I know you kind of made mention earlier.
Thank you. Yeah, I'm really happy and glad that this is being pushed out by the board to get an understanding of what's going on and regarding medication error. And of course, medication error includes people getting wrong vaccinations. So I think that's why it is important for us to include some questions about immunization practices specifically. I also want to add, there is a question number 5, are you in a management position for your employer? And it says e.g., example, pharmacy managers and district manager. In most cases, pharmacy managers are separate from district managers, and district managers are more so considered a management position. And pharmacy managers are sometimes not really considered a management position. So I think that is important to distinguish those two. Also, I would like to see if it's okay to add some questions about pharmacists in charge's autonomy if they're given enough resources to be able to perform their jobs. In my perspective, I believe pharmacists in charge who are under tremendous amount of responsibility in the eyes of California Board of Pharmacy are not well equipped to really be able to do their jobs. So I would like to add some questions on understanding if they feel that they have enough resources to be able to do what they're required to do as a pharmacist in charge. And finally, I'm curious about all the logistics of how this is going to go. Is this going to be anonymous? Because if it's not anonymous, I'm concerned about some responses, how honest they're going to be, and who's going to have those data, and how are we going to get this out to as many pharmacists as possible to get the best results as we can. So that's that. Sorry, a lot of comments.
Hey, Anne, can you review how this is sent out?
Yeah, so it is intended to be anonymous, so people feel comfortable to share. With respect to deploying it, I believe that the plan is to partner with Solid, but we can release it through our pharmacist listserv, of which everybody's required by law to be a part of. So in terms of reaching the broad audience, I think we're well positioned to do that. And then with partnership with Solid, using the survey tools at their disposal to both receive the responses and then aggregate the information.
And then in regard to the couple comments, immunizations, clarification, management positions, questions for PICs, are all those appropriate, and could we add them into this survey?
So I think that it's the board survey. So I think it, it's fine. I think it's what your desire is. I would say that specific to the PIC, I'd probably want to work with counsel in terms of how that is crafted. And then I do think that part of the survey, sorry, I can't pull it up at the same time, speaks to the supplemental services that are provided. So if member O wouldn't mind just providing a little more information about what you're kind of looking for. Is it a volume kind of thing, or what were you looking for with respect to the immunization practices?
Well, immunization practices, I was hoping to see if we could get some questions on if they have sufficient resources and to be able to provide adequate screening for the immunizations. If there's any pressures from the corporate to push for any immunizations, unnecessary immunizations, and if there's been any errors or mistakes that have been made because of those rushed practices and not enough resources to be able to do their job. So that's the kind of what I'm looking for with immunizations specifically. Just because the other things that are on there, that it asks you number 13, which of the following additional patient services are provided. Of all those things, immunizations are almost given nowadays to be a part of the service for community pharmacies. So I think we kind of need to have some more specific questions regarding immunization practices, if allowed.
I mean, so the next question asks, how many they're doing. I mean, I guess, yeah, there's kind of a fine line here between, the business of pharmacy and the, regulation of a pharmacy. I don't know, Anne, is that, I mean, is that enough information?
But we're just asking a question to licensees on how they think, so I don't see why that's gonna be a problem for us, but.
Yeah, so I'm happy to try to work with Solid and try to draft, I think, right, the key is drafting questions that are neutral so that we're not trying to sway the person to respond in a certain way. But I think we can try to craft questions around these as well. And I don't know where I don't know where you all want to go, but if this was intended as a first draft kind of thing, and if the committee feels like we're going in the right way, the committee has in the past authorized staff to work with the committee chair to kind of finalize something, if the board thinks it's appropriate as well. So I think it's really getting some feedback and then seeing where we need to make additional adjustments, working with, the experts to make sure that we're writing it in a neutral fashion, because the intent is to get the information that's necessary for the board.
Yeah, and I think look at question 16, it says, does your primary workforce employer use workload metrics in the following area? And one of them is the number of immunizations. I mean, I guess I want to, yeah, maybe, I think we'll bring this back to the committee before we have you give it just to the chair and the executive officer to fine tune. But I think we also need to be careful we don't go down too narrow on any one topic.
Debbie, I'd like to say that when I read all the questions, I was just wondering, could something like, what do you think of your overall working conditions? Would that just take in pretty much anything if there's some issues?
So I guess I'm not sure that we're supposed to be measuring working conditions. I don't know, Ann. It seems like we're our goal here is to understand, what pharmacists are doing.
But Debbie, unfortunately, working conditions directly related to medication errors, in my opinion. So I think that's why it is relevant.
Yeah.
And I think it's most important. I thought that was what the whole survey was about.
I'm sorry, say that again, Cheryl?
No, I thought the whole thing when we asked about getting a survey was because of the working conditions. I thought that was something that was important. Something important to be getting from the pharmacist.
Well, I think in kind of questions like, do you have sufficient time to do consultation? It's asking, about kind of specific pieces of the work environment. I guess working condition. I mean, so I think we do ask a lot about, how your workload is.
Debbie, I'm sorry, this is Ann. Cheryl, question number 24 is really kind of intended to provide an opportunity for, licensees to provide additional information. Do you have concerns with how that one is worded? Because it's really kind of intended, again, to, give another, like, these are items that we've hit. Is there anything else that you want to tell us that kind of impacts patient care or medication errors?
Okay, and thank you for referring to 24, because guess what? I printed mine out and I went and it just printed out to 22. So I did not see 24.
And question 23 looks like it's one of those open-ended, but we don't have a box for additional comments. Is that something we could add?
So question 23, which is, I'm going to read it, Cheryl, just because I don't know that you have it. It says, do you believe the pharmacy staffing in your primary work site is appropriate to ensure adequate patient care? And that is intended to be a yes or no answer.
Okay, yes, that's fine. Thank you. Yeah, sound like 23 and 24 would give you that information. And those two I didn't see.
I had a couple of questions. How are we going to monitor the authenticity of these surveys? Are we just sending an email with a link? That email can be forwarded to anybody, licensed or not licensed.
So I think that the intent is we're collecting demographic information. And, I think we're hopeful that only people that are licensed pharmacists in working in California are going to be responding. I think when we send out our surveys as part of our exam process, where we're surveying, we kind of do the same kind of process. I wouldn't say our response rate is super high, but I think it's one tool. It's not the only tool.
My only concern is, Ann, if a employee was recently terminated or reprimanded for work-related issues, I could go back onto it and take 200 surveys and make it look really bad and not even picture the right picture that's out there.
But I think that could be said the same thing about the employer, though. So I think that could go both ways.
That's my concern about conducting a survey of this nature on an open-ended email. I think this should be part of your license renewal. So the authenticity of this is maintained, and we should survey everybody, technician, interns, pharmacists, everybody. If you want to survey everybody. Authenticity of these surveys is so important. I mean, in today's world, it can go fast so quick. You just put it on your friend's thing and go, okay, click on this link and take a survey for me. These are the answers, that type of thing. And do we really want? And like Sung said, absolutely, both ways. And and then we are putting board members and board staff to analyze this data, which could be fudged. And is it something that we want to really rely on?
But are we really thinking that our licensees in the state of California are that standard? That, I mean, I get it, there's one or two bad apples, but I know that most of our licensees are honest and hardworking people. So I know that not, most of them is not going to be forged. I think that'll be a very, looking from a very bad perspective and with a very bad assumptions. I mean, I understand, but I think that that's just like minor detail that we need to put faith in our licensees and that they're going to act responsibly.
Absolutely.
Has the board ever conducted a survey similar to this? What is the response rate? And I think that upon deployment that we can implement some sort of protocol that ensures authenticity.
Yes, and the board has done surveys before, and we felt pretty, I mean, overall, I know the 8 years I've been around, I didn't find that we felt that there was any problem like that.
Does NABP have like a national database on?
So they have, NABP has their e-profile system, but there's no requirement for pharmacists to be in it, if that's what you're referring to. So there's no requirement for California pharmacists to be in there. And there's also, not necessarily a lot of data integrity. I think, I think if you're looking to validate all of the responses, the way to do that would be to require people to disclose. But I think if you require people to disclose who they are, that might undermine the value of the survey itself.
Correct. I mean, either way, we are in a tough position here, and to collect this data. And again, my fear is not what the data is going to come out as. My fear is just that we want this to be authentic, and we got to be sure that it was. This is almost like collecting votes, and we got to have some way of measuring that.
Ann, is there a way we could talk with folks within the Department of Consumer Affairs and see if there is a way that we can kind of validate it? Because I'm thinking, like, if you renew your driver's license, your license plate, like you go on the website and they have like that number that you put in so that they know this is like valid. Or I've even done like Survey Monkey things where like there's like, they don't really necessarily know who you are, but you have like a validation number. Can we just, check in the meantime, we'll bring this back to the committee at our next meeting. Maybe kind of work on a couple of these questions, see if we can kind of spiff them up a little bit, but also investigate if there's any way that we can, just bring some validity to it. I agree with what both Song and Jig are saying. I do think our pharmacists, just like the students, for the most part, I think they're great. They're honest. But every so often we do have a couple that aren't, and so it's hard to identify them, especially in an anonymous survey. So what do you think? Could we try to do that, see if there's any options?
Oh, absolutely happy to have the conversation with them.
Okay. Are there any other items on the survey? I think we've heard from Cheryl and
I have a comment. I have a comment.
Yeah.
Yeah. I want to make sure everybody understands I am for the pharmacists and technician to participate, to do the testing and vaccination, but I would like to see it on a voluntary basis. So I would like to see 2 questions to be added on the survey. Is it the test and vaccination, is it optional to the PIC? And the second question is any retaliation for the PIC or the pharmacist do not want to participate. So I like to see those questions in the survey.
I have a suggestion. I think, going back to my authenticity question, I think there is a way to make a link where it is only one-time use on individual to each email. So if we email it to all the licensees, and once they take the survey, the link expires. I think that's the best way to do it.
But I think the concern with that is also someone who may not have an hour to sit in front of a computer. I mean, I think our goal should be to get as many surveys as we can, and once we get to a certain number, everything balances out. So I really don't think that authenticity question is that legitimate. I mean, I don't think that it is important, but I think that's just the wrong thing that we're focusing on. I mean, once you send the one email, and then what if that person has to step away? Is that person then not going to be given a chance to take the survey?
No. If you look into
Let's table that part of this discussion and see if we have options. And then we can figure out from the options of of the validity or not, and what those options are. Versus kind of beating it around now to even know, we might be talking for naught. So Albert, I took notes that you want, and specifically your questions are around immunization, whether it's optional and retaliation. Are those specifically around immunization? Albert?
I'm sorry, I did not turn on. So mainly testing and vaccination is optional or not. Should be optional to the PIC. And also, do they get retaliated if they do not participate?
Okay, got it. Jude, was there anything you wanted to add as far as the questions?
No, there are lots of questions, and again, it is going to be interesting how everybody would respond and everybody's interpretation. But I'm open to survey. Let's bring it on.
Jason, did you have any thoughts around questions that we should include, or perhaps questions that are in here that we don't like?
No, nothing further, Debbie. Thank you.
Okay.
Maybe make it simpler so more people participate. I'm usually interested in taking a 2 or 3 step survey than a 24 question survey.
I had the same thought, but all right, Anne, maybe you and I can put our heads together with these comments and kind of go back and look at the survey and bring something back to the committee at our next meeting. Moderator, will you please open it up to the public?
This is moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on the screen. Type "I would like to make a comment" into the ask field and submit to all panelists. Our first comment comes from Jazzy Graywell. Jazzy, your line is open. You will have 2 minutes.
Thank you. Jazzy Graywell with UFCW Western States Council. Would just like to echo some of the comments around the anonymity of the survey. When there is anonymity, workers are more free to share what their workplace experiences are. When there isn't, they might not fully share the full picture as it relates to mistakes or issues that are happening in the pharmacy out of fear that they might be penalized or investigated by the board. And so in order to actually understand what the workplace issues are currently that are affecting pharmacists, there needs to be some level of anonymity that workers feel comfortable fully sharing details of what is actually happening on the ground through their experiences. And then also would like to urge the board to engage with community organizations who can also be helpful in distributing the survey to individual pharmacists and pharmacy technicians. Thank you.
Thank you for your comments, Jazzy. And yes, absolutely, anonymity will be a must.
Our next commenter is Mark Johnston. Mark, your line is open. You will have 2 minutes.
Hello, this is Mark Johnston, CVS Health. If I remember correctly, there's been a pretty significant dishonesty problem that California board has faced in the recent past, perhaps leading to one of the agenda items today. I would like to point out that there are plenty of for-profit companies out there, none of which I am associated with, that do surveys for a living. Perhaps the board should invest a few dollars to ensure that their results are number one, private, and number two, accurate.
Thank you.
Our next commenter is Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Yes, thank you very much. First of all, I want to say I agree with Mark Johnston. Doing surveys that give you value information upon which you can take good, solid action is actually a very complicated science. There are people that I've worked with in one department at Kaiser Permanente where we had 3 PhDs in survey design just to get good information so that we could make good decisions. Stanford University also had a department, I think it's still there, of management engineering, and they did the original surveys that limited hours and working conditions for airlines, for truck drivers, and also surveys on how many people a physician felt they killed during their residencies. So they have a lot of experience in these surveys too. So outsourcing may be a good thing. There are several questions that I consider problematic. One of them, for example, is question 22, I believe. Let me just call it back up here. And it has to do with, 21. 21 defines the types of errors that you're looking for. But that should come before question 19, because when you ask in 19, what is the average number of medication errors, they haven't yet got a context of what you're calling a medication error. So it's design flaws like that that will really make a difference in the quality of the information. Also, in the terms of the metrics, the most common metric in community pharmacies, and I presume this only goes to community pharmacies, is waiting time. And the average waiting time. They have monitors that actually show green, yellow, and red in some pharmacies when the waiting time goes above 10 minutes, 15 minutes, etc. And that is based on surveys of customers as what they think is the most important service component of the pharmacy.
10 seconds.
So I would suggest, again, contracting out to professionals and really getting into this. Thank you.
Thanks for your comments.
Seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Okay, moving on to agenda item 9, discussion and consideration of waiver requests of EPC section 4131B relating to the location of supervising pharmacy and remote dispensing site pharmacy. So after the release of the agenda, this request was withdrawn. And so at this time, there will be no action on this agenda item. Moving on to agenda item 10, the review and discussion of licensing statistics, which are located as attachment 5 in the packet. You can review the detail of the licensing statistics. I'm not going to actually go over anything specifically other than just to comment on the processing time, and our staff continues to work diligently and makes adjustments to, during this pandemic to try to keep our processing times within the standard that's allowed. That is our goal. And I think if we look specifically at the processing times, there are a few application types that needs to be, fine-tuned, made a little bit better, but I know our staff is constantly monitoring this and trying to keep our processing times as current as we possibly can. Are there any comments from the board members on the licensing statistics? Moderator, would you please open it up for the public for any comments on licensing statistics?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Okay, the final item on our agenda before adjournment is just to call out the next committee meeting dates, and the next one will be April 21st. We also anticipate one on July 14th and October 27th. Board members, thank you very much for your work and being prepared for this meeting. I do appreciate that, and your time, as always. And stakeholders, appreciate you taking time out in your busy schedule to join us and provide comments so that we can, try to be the best we can be. With that, meeting adjourned.
Thank you, everybody.
Thank you.
Thank you.
Thank you. See you guys in the board meeting.
Yes, that's 4. Okay.
Hi, Cheryl.
Hi, how you doing?
I'm doing fine.
Good.
Cheryl, give me your phone number. I changed a new phone when I transfer the data. You're not on the list.
Oh, okay. Well, you know what? I'll text it to you.
Yeah, text me your phone and your email. Thank you.
Okay, I'll
Thank you.
do that. I'll do that.